In this week's deep dive, we're going to take a look at the body as it's been cut in the mid-sagittal plane, meaning it's been cut right down the center. Now, the reason why this type of a cut is so important is because it allows you to see a lot of different anatomy all at once. So if we begin up here at the head, you're going to see that, well, we've actually cut off the top of the cranium as well as removed the brain, but you're also going to see some of the meninges in here. So this is called the dura, and the dura actually would surround the brain and help protect it, but we have that kind of hanging around. Now, you're still going to be able to see the tongue, you're going to see some of the nasal anatomy in here, and then you're also going to see, we're going into the pharynx, and behind that we have the beginning of the cervical spine. So you can see parts of C1 and C2 as it goes all the way down. Now, you're also going to notice this right here, which, if I could get my probe under it, that is going to be the spinal cord. Now, the spinal cord is going to be protected and it's going to be encased in bone, but given the nature of the cut and the simple fact that when you die and are preserved, you're not preserved or dying symmetrically. So even though when we cut you, you may be a little bit skewed, and so we do our best to make sure that the cadaver is going to be right down the center, but occasionally it's not going to be able to work. But what that allows us to see here is part of the spinal cord as it then dips into its bony encasement so it can be protected. And then you might be able to see this, there are actually some bony projections behind it, and those are going to be the spinous processes. Pretty much the pokey parts of bone on your back. But you're also then going to see a bunch of adipose tissue, muscle tissue behind it. But you can see the natural curvature of the spine. So this curvature going forward like this is what we call a lordotic curvature. Just means that it's going forward. But then you're going to see that it's transitioning into a kyphotic curvature. Kyphotic curvature means it's going backwards, so it's like a hunchback. And then it's going to keep progressing and go back and swing anteriorly again into a lordotic curvature. And then when it gets to the sacrum and coccyx, it's once again going to go into that kyphotic type of curvature. Now, the thing is, if we come all the way back up here, you're going to notice that these discs, these intervertebral discs, are going to start thinning out and starting to become non-existent really in this area. And that shows me that this individual had a bit of a hunchback. And so they had a bit of kyphosis. And what that does is it squeezes the discs and they start to deteriorate. So we call that degenerative discs. But you're also going to notice in this area that there is a lung missing, and that's because we took it out, but that allows you to see inside of the pleural cavity or the thoracic cavity. That's where the lung and the heart would be. You're also going to see that the liver has been cut, because that liver is primarily going to be on the right side, but it does project onto the left. You're also going to see part of the aorta coming down, so this is just a gigantic blood vessel. And then we made an incision right here, so obviously you're not going to be able to see that from where you're looking, but you're able to see kind of anteriorly looking down at the intestine. But you can also see part of the stomach here, which has, we're in that pylorus, and you're getting into what's called the pyloric sphincter. So basically this is where the stomach is going to start transitioning into the small intestine. But coming back here, you can see the spinal cord coming out again, but it's really not the spinal cord. Instead now, it's a bunch of nerves, and this is really, really cool. This is what we call the cauda equina, and it literally means horsetail. And it's basically your spinal cord, which again, if we come back up here, you can see is a more solid structure. Once it gets to around L1, it then turns into all these different nerves. And those are then going to go down and go to the various parts of the body, right? Going to go to the lower limb and so on and so forth. But again, you can now also see these intervertebral discs here in the lumbar region. So actually, I should probably say that. We call this the cervical region up top. Then we call this the thoracic region where the ribs are all going to be attaching. And then your low back is what we call the lumbar region. Now, you're going to notice that these intervertebral discs are very thick here, as well as the vertebral bodies. That's going to be these giant segments of bone. And when you compare that to up here, you're going to see much thinner intervertebral discs and much thinner vertebral bodies. And that's because the vertebral body specifically supports weight. And obviously there's going to be more weight needing to be supported down here in the lumbar region than there would need to be up here in the cervical region. But these intervertebral discs are also really bulbous, and they've even cracked a little bit, and that's just due to drying out and then the nature of the cut. But this just tells me when you have these really thick intervertebral discs like this here in the lumbar region, but a lot of thinning out here in that thoracic region. That, again, this individual had more of a hunchback and likely was resting, not really putting a lot of or spending a lot of time on their legs, meaning that their discs in their lower back aren't being squeezed. So they're able to kind of expand. This basically just tells me that there's more or less a sedentary lifestyle. And again, that's a big assumption on my end. I don't know that. It's kind of what I like to call this Sherlock Holmesing. It's where basically I see things like this, and then I try to draw conclusions as to why it could be like that. But I honestly don't know. But then again, you can we go back into that sacrum and then going into the coccyx. Now what's also cool though is you can see a lot of pelvic anatomy. So you can see the rectum, you can see part of the colon here, you can see the uterus, as well as the bladder underneath it, and we can even see an ovary here. But so again, you can it's the reason why these cuts are so amazing is because you can just see so much anatomy all at once. But what's fascinating to think about is, what if we had made the cut instead of mid-sagittal, parasagittal, where you're actually just going, you're starting to go towards the side, you're starting to go laterally. You can see that you're going to then capture a snapshot of the same anatomy, more or less, just in different locations. And so it's really useful to learn anatomy from this type of cut. So I really hope you've enjoyed this week's deep dive, and I will see you next week.